We are joined today by Dr. Allison Sepowitz of Buffalo Dental Implant Group. Dr. Sepowitz, thank you so much for coming by.
Thank you for having me.
Now, first off, you are a periodontist, which is your specialty. Why
Yes.
did you pick that?
So first I'm just going to talk a little bit about what a periodontist is.
Okay.
So periodontist, a periodontist is a dentist who's a surgical specialist. So that's basically we specialize in the gums and the bones around teeth and dental implants. A periodontist is a dentist, but then we go to school for additional training, 3 additional years to become truly an expert in this very specific subspecialty. So periodontist, you may come see a periodontist if you are have gum disease, which actually affects 50% of people over the age of 30.
Oh, wow.
You may have some receded gums, so like the length of your teeth appear a little longer, or some teeth may be loose or just have like red and swollen gums.
Okay.
So that's one reason. But then a periodontist, the goal ultimately is to help you save your teeth. But sometimes this teeth can't be saved. So when we can't save teeth, we are also experts at taking out this tooth and placing a dental implant. And this could be as simple as a one-tooth solution, like maybe it's just one tooth that's a problem, or it can be as complex as a patient that needs all of their teeth removed, or maybe they don't have teeth at all. And this is actually like a really common problem. Like 36 million Americans don't have teeth right now, and 120 million are missing at least one tooth. Yeah. So it's super, relevant for our population.
Yeah, you do a big job.
Yeah. So kind of what geared me towards periodontics is that I really love like the actual job, like the actual clinical skills. I have always enjoyed working with my hands, and I think it's really, it's an art and a science for sure. But that's like the more technical aspect of things. I like that with one procedure, whether it's small or whether it's big, I can really like transform a patient's life, which is really cool. But on the personal level, I really like that I can develop long-lasting relationships with patients. So with my specialty, you see a patient usually for a procedure, or 2 or 3, whatever it is, but then they don't just go away. You're always around. You're coming for cleanings, there's maintenance, just like a car would need like oil change. Your teeth in your mouth, need oil change as well. So that's when you really get to know patients.
Right.
So that's like from a personal aspect, something I really liked about this, about periodontics, because it's something that, over the years, I can really develop these relationships with patients.
That's awesome. Tell us a little bit more about Buffalo Dental Implant and what you guys have to offer.
Sure. So Buffalo Dental Implant, we are a group practice, and there are 3 periodontists. So there are 3 people like myself who are experts in dental implants. So if you want a dental implant and you want like the most subspecialized person doing that, that would be us. And so that's what I think is really advantageous. And again, we specialize, like this is literally what we do all day, every day. So we're really focused on that and, mastering our craft. So again, it can be as simple as like one tooth, or it could be, many teeth or something like that. And another thing that is really cool about our practice is that we work with a bunch of general dentists in our practice, but we also work with general dentists in the Buffalo community. And no matter who it is, like as periodontists, we love like collaborative, comprehensive care, because that's what it's all about. As a periodontist, I lay the foundation, but really it's the restorative doctor who's making the pretty house on top of the nice foundation.
Yeah.
So we really enjoy that collaboration together.
Absolutely, and I'm sure you kind of touched on it, but you have such rewarding stories that you get from your patients, right?
Yeah, definitely.
Tell us a little bit about that.
A patient, he's in his mid-60s, and him and his wife came in, and he didn't have any teeth on the top, but he had an old denture. So that's something that's removable. And then the bottom teeth were all like decayed and painful, and they had to be ultimately removed. He never smiled. He showed it, like even in person, he was like barely smiling. And that's so sad to see, you know? And him and his wife are like, we just need something. So basically what we did in one procedure, we were able to take out those teeth that all were painful and had bad cavities and place 6 dental implants. And then we were able to actually give them like something that's fixed in their mouth to replace the teeth. and a new denture that same day. And then he was done. It was during that procedure. That, again, these are temporary teeth, but still they're fixed in their mouth. And
in that day, he came out kind of like a whole new
totally
person, I'm
and
sure.
then he comes out and he's smiling, and his wife was crying when she saw him. It was so special. And so not only did it look much better, but from a health and most importantly, from a health and a functional standpoint, it was so much better. And he was even saying, I have to get used to having teeth back here because I didn't have teeth there before. So that's just one example. And that's just the one day. The most rewarding is after, of course, the wife's reaction and everything, but then as time goes by and they're coming for maintenance and then they get their permanent teeth, their finals, that's super rewarding to be able to see that transformation of that patient. And then of course years later, that's the best when they're just coming in for their routine maintenance, hey doc, nice to see you,
and they're smiling.
Yeah, and they're smiling.
It is awesome.
So yeah,
we know that a smile, your dental hygiene can really change how you feel about yourself, your overall health, and your confidence level. So you guys are really doing such amazing work.
Well, thank you.
Now, for our viewers that are blown away and maybe could use some help from you guys, how can they find out more information? So
you should visit our website at www.buffalodentalimplant.com. That'd be the best. Or you could give our office a call for a free consultation. 716-882-3777.
Dr. Sepowitz, thank you so much for coming in and sharing more about your incredible practice.
Thank you. It was nice to be here.
And if you would like to learn more about their practice and service offered, like she said, just head on over to their website at buffalodentalimplant.com.